Death is an undeniable truth of human life. The last funeral I attended broke my heart. That's how the feelings are. But an unusual death at an early age is more heart-wrenching than anything else. It beats it all. Do you remember the character of The Life of a Pi? Irfan Khan, the brilliant actor, died of colon cancer at the age of 53. Or remember Chadwick Boseman? Yes, I'm talking about the Black Panther hero who died of colon cancer at the age just 43. Well, today on 2nd September, another famous person from Hollywood also died of colon cancer, Greg Leaks. Well, the list will go on. The loss is huge and the damage is done. But still, it's a warning, guys. We still have time. We still can make it to the end. First, we need to know what cancer is. Cancer starts when cells in the body starts to grow out of control. So, what is colorectal cancer? Colorectal cancer starts in the colon or rectum. These cancers can also be called colon cancer or rectal cancer, depending on where they start. Colon cancer and rectal cancer are often grouped together because they have many features in common. How does colorectal cancer start? Answer is mostly polyps in the colon or rectum. Most colorectal cancers start as a growth on the inner lining of the colon or rectum. These growths are called polyps. Some types of polyps can change into cancer over time, usually many years. But not all polyps become cancer. The chance of a polyp turning into cancer depends on the type of polyp it is. Well, you should know there are different types of polyps. Other factors that can make a polyp more likely to contain cancer could be if a polyp is larger than 1 centimeter, if more than 3 polyps are found, if dysplasia is seen in the polyp after it's removed. Dysplasia is another precancerous condition. It means there is an area in the polyp or in the lining of the colon or rectum where the cells look abnormal, but they haven't become cancerous. Do you know how colorectal cancer spreads? It is a very important part. If cancer forms in a polyp, it can grow into the wall of the colon or rectum over time. The wall of the colon and rectum is made up of many layers. Colorectal cancer starts in the innermost layer and can grow outward through some or all the other layers. When cancer cells are in the wall, they can grow into blood vessels or lymph vessels. From there, they can travel to nearby lymph nodes or the distant parts of the body. I know most of you are aware about the stages of cancer. Well, it is very important because if your disease is diagnosed at an early stage, most likely you will survive. The stage of colorectal cancer depends on how deeply it grows into the wall and if it has spread outside the colon or rectum. So if you have doubts, go and check up with your doctor immediately. Types of cancer in the colon and rectum. Most colorectal cancers are adenocarcinomas. These cancers start in cells that make mucus to lubricate the inside of the colon and rectum. When doctors talk about colorectal cancer, they're almost always talking about this type. So it's the most common type of colon cancer. Diet plays a role. Colorectal cancer is the third most common type of cancer for both men and women. Smart food choices may help you lower your chances of getting it. Some studies say that people who eat right, exercise, stay a healthy weight, and keep alcohol to a minimum may cut their odds to the disease by more than a third. Eat dairy, whole grain, beans, colorful fruits and veggies, and fish. Also, you have to limit yourself from eating red meat, processed food, and alcohol. With that said, stay healthy and fit. Subscribe to our channel for more videos like this.